Ayush profoundly within the national health architecture to advocate for comprehensive assessment and empirically validate care, thereby facilitating both domestic and international recognition of traditional therapies. Integration with schemes such as Ayushman Bharat and of Ayushman Arogyam Kendra are projected to enhance the accessibility and financial feasibility of healthcare services. The strategic objective encompass uh, expanding from a local to global footprint, augmenting popularity, and conferring stakeholder status upon Ayush within the global health domain. Underpinning Ayush are foundational tenets including diet, sleep, and discipline. Some emphasize preventive methodologies over remedial interventions. It pur- purports to address a spectrum of pathologies, including lifestyle associated communicable and non communicable diseases, having demonstrated notably utility during the pandemic. Future progression necessitates the development of structured treatment protocol and integration of clinical practices synthesizing the most efficacious elements of modern and traditional medicine. The key systemic impediments include challenges pertaining to standardization, quality assurance, and the generation of empirical evidence. Ameliorative strategies proposed include the incorporation of IOS into scholastic curricula. Emphasis is placed on promoting research endeavors, clinical, herbal, and evidence generation to substantiate traditional methodologies. Collaborative interdisciplinary research involving Ayush, allopathy, and leveraging advanced technology like AI deemed crucial. Publication of research finding is identified as necessity. Capacity augmentation is essential, necessitating educational reform, scientific updating, and expansion of clinical training at postgraduate and doctor echelons. The deployment of is advocated by remote consultation. Specific treatment protocol are requisite for conditions such as tuberculosis and cancer. IUC intervention are suggested for mitigating gemotoxic sequelae on organ associated with chemical-based pharmaceuticals, thereby improving patient quality of life. Exemplary religion initiatives such as Kerala NAM project involving mobile Ayurvedic clinic and gender-specific health programs present innovative models. Lesson from such models underscore the criticality of fundamental shift in public and professional mindset. Mandatory action including standardizing the manufacturing processes for Ayush pharmaceutical in accordance with good manufacturing practices (GMP), ensuring stringent quality control and implementing pharmacovigilance. Reinforcement of regulatory framework is equally imperative to ascertain safety and efficacy. Challenges persist due to contradictory perspectives regarding specific practices, example honey consumption, and the prevalence of myth or apprehension concerning potential adverse effect on vital organs. Rigorous validation of establishment use regimens pertaining to diet, sleep, disciplined seasonal adaptation, and daily routine is necessary. Ayush is characterized not as an auxiliary or alternative system, but as original medicine. Its trajectory involves integration with science principle, digital transformation, and expanded global research reach, fundamentally redefining and conceptualization of health, expanding the demographic reach to underserved and rural sectors necessitates the requisite deployment of Ayush personnels within primary healthcare infrastructure, including primary health center, PSCs, and via community health workers, ASHA workers. The Ayush protocol is maternal and pediatric care is feasible. An integrated and indispensable approach is advocated and acknowledging that each medical system exhibits inherent limitation and therefore mutual complementarity is essential. The underlying principle align with a concept of unified health advocacy convergence upon a holistic wellness paradigm rooted in Ayush principle with a paramount focus on preventive and health promotive strategies. Ayush exhibits relevance in contexts such as disaster management, mental health provision, and general health preparedness. It encompasses psychosomatic and mental health dimension aligning with my multifaceted nature of health, physical, mental, emotional, social, spiritual, and contributor to spiritual elevation. The benefits accrued from Ayush are characterized as India's contribution to global well-being. The ethos of One Health intrinsic to Ayush extended its purview beyond human health to encompass the health of soil, water, flora, and fauna, encompassing non-chemical modalities, herbal